How perfect this picture is.
Isn't that cute?
Oh my god, that's so cute.
Hey, Ross.
So cute.
What's up, man?
How you doing, bud?
Got the
What's
cactus
this?
in the building. That's my phone.
Hey guys. Let me see. The live has started and I am so excited for today. Excited to chat with everybody out there. As you guys know, this is Women's Wednesdays. This by far is becoming one of my most favorite days of the week because I get to chat with women everywhere, all over the world, literally. And the goal is to talk about things that we all can relate to about us women. And also the guys are invited too to hear the things that us women like to talk about. And everything from life, love, anything, all the things that come to our mind, how we're trying to figure out things about ourselves, learn about ourselves, but most importantly during this time of COVID, because it's such a unique time. And I think the reality is that during this time, the most important thing that I always like stressing is that we're all in this together. This time period that we're going through, literally not one person is left off of this boat. COVID-19 sees no color. COVID-19 sees no socioeconomic status. It is a very strong virus, one that we're all trying to figure out. I always say to people that we're living in a time of the unknown. And so what I've discovered in this time that I just kind of been thinking about, that's been kind of like heavy on my heart, honestly, heavy on my mind, is that because I am a pregnant woman, I think about other pregnant women like myself during this time. And I think like the things that I'm learning about or having to experience. And I'm like, okay, well, I would love to hear from other pregnant women around the world to know what they're experiencing as well, because you don't really hear that much about us women in the news. You don't really hear too much details about a woman being affected by COVID. There's been a few stories, also babies being affected by COVID. There's been a few of those stories as well, but not really as many as we hear on a daily basis of just the general population and just how everyone's being impacted by the virus globally. But I'm very sensitive to us right now because I am learning about things every day, or not every day, but through every experience. And great example, my ultrasound. Like I was really, really bummed and taken aback a little bit because I couldn't do my ultrasound with my husband. I couldn't do it with Russ. And that was really, it's like one of my favorite moments that we look forward to. You know, you do it every, 4 weeks. And you do it as needed as well. But that's kind of like one of our highlights to our experience that we get to have while I'm carrying the baby. It's kind of, I think, the man's way of being able to be in tune with you and in tune with the baby. So they kind of get to have their moment too by seeing the ultrasound with you and being able to see the photos and just being in the room with you, being your support, holding your hand. Like I'm the kind of woman that I love holding hands through it all. And Russ is the same way. Even if I'm doing getting my blood withdrawn, he's in the room with me. He really is an every step of the way kind of guy, down to just all the checkup process, without saying too much, if you know what I mean. But, to not be able to have that experience, was a bummer. And then I think about, okay, when it's time to deliver, what is that going to be like? I know in some places for a short period of time, they weren't even allowing mothers to deliver with their spouses. I think that's changed, and we'll talk about that later because I'm excited that my obstetrician, Dr. Robert Katz, is going to join us today, who's delivered all my babies. He is like family to me and one of my most trusted sources that I go to in this time to ask questions about the era of COVID-19, how I'm affected by it, how, he helps me with understanding about giving me the updates on all the new discoveries that are happening. So I'm looking forward to having him join us on the call today. And then I also reached out to other women like myself, and I know some of you guys submitted some of your names to the Beauty Marks Entertainment Instagram page. So I'm going to talk to 2 women today, at least 2 today, or a few of you guys, and we'll have probably like a good 5 to 7 minutes or so, because I want to make sure that we get all of our questions in, that my doctor can hear what you guys are saying, so when he hops on, he can educate us all about the pregnant woman in the COVID-19 era. This is really a historic time, historical time, and I think that the thing about this for me is, I'm like, being a pregnant woman in the era of COVID-19, I want to journalize what's happening, because I've never experienced anything like this before. I've never seen anything like this before. I know there's talks of like this being worse than the Great Depression. Like, there's all these things that are just kind of like so much to learn, but carrying a baby in this era is very, it's a very unique time, and I try to be positive through it all. I try not to overthink things. Like, great example, I can't plan a proper baby shower right now, because I don't know, like, we don't know when it's going to be properly safe again to even send out invites. And we know that if you send out invites now, no one can probably commit, because they don't even know. Our 2 kids have birthdays coming up. April 28th is Sienna's birthday. We have to do our birthday party at home, and Future's birthday is May 19th. We have to do our birthday party at home. But again, going back to the baby specific stuff, their baby rooms aren't even done yet. And I'm like, thank God. I'm the hand-me-down kind of mom, so I thank God that I've saved a lot of my hand-me-downs from both Future and Sienna, because I think anyone that knows me knows I love kids, and I actually do love having kids. So I saved a lot of the hand-me-downs from their experiences to say, just in case. And then I gave away a lot of stuff too. But there were key pieces that I really liked for boy and girl. And as you guys now know, I'm having a boy. So I thank God that I saved those. But as far as their baby rooms go, I'm literally going to have a virtual conversation about how we can get all the items that we need for the baby room. And then we'll know the perfect time to put those items in his room. And so, I can't help but think about all the other women that are like myself during this time, and just kind of thinking about some that may not even have as many resources during this time, and just thinking about each and every one of you and wanting to talk about us. There's not that much conversation about us. So I wanted to talk about us, talk to each other, and also inform each other in the process. So I think that being said, let's get into our conversation for today. First up, I'm going to try to reach out to a sweet woman. Her name is I think it's My Name Jazz. I think it is. I'm going to reach out to her because she's actually in the Johns Hopkins Hospital, and she's on bed rest right now. And her baby has to go to the NICU. And to my understanding, they can't even see their baby right now, which is crazy. Because I know that first moment when your baby comes out, and how you want to go, and how you want to bond with them, and how you want to be around them. And so I want to speak to her and kind of learn more about her. So let's check her out. Hold on, let's see here. Should we put here? My name. Perfect. There you are. My name Jazz. Boom. Okay, now once I do that, why isn't that letting me pull this down? Hold on. Uh-oh. That's it. Wait. Pull your finger down here. As we're calling My Name Jazz, I'm just trying to get my keyboard to drop down. I swear, man. Me and this thing. Name. Okay, great. All right. To go live with someone. Why doesn't it let us do it? Okay, hold on. Let me try this again. Hold on.
Don't hit search.
Search? Oh.
We'll hit search.
Okay.
Or no, sorry, don't hit search.
Don't hit search?
Yeah, go.
If she sends me the invite, it probably will help. Sorry, My Name Jazz. We're trying to get you on here. Hold on.
Wait, you can go back to the room. I think you should scroll. So like.
Oh, okay, here, I'll do like that.
Yep. And then her thing was yellow. Oh, I see.
Hold on. Because that's in the invite circle. Sorry, guys. I'm just trying to get my name, Jazz. I swear. If you guys have been on any of my Women's Wednesdays and sometimes my random talk show Tuesdays, I struggle with this thing here.
But it's acting weird.
I know, it's being really weird. Hold on, guys. We're going to get it. Okay. Hold on. My name, Jazz. 1 second. Yeah, no, because everybody sends in groups. My name. I know what I can do. We need IT on this thing here.
Mm-hmm.
If my name Jazz could send, if you could resend your invite, your request again, would be awesome. And we're trying to get my name Jazz on here so we can talk with her about her her experience being bedridden and in the hospital in Johns Hopkins. So sorry, guys. Please forgive us because this technology is beyond our control. And then I also today I'm going to speak with a pregnant nurse as well, who has been having, some unique experiences during this time. Okay, let's see if we can get it. I think she sent it. Nope, not yet. Sorry, guys. Come on. I'm going to try there.
Mm-hmm.
Can't I send an invite out?
You can.
It's just not coming up. We can send an invite to her. I swear, every time I try to do this thing, it just always goes crazy. My name, Jazz. Hold on. We're trying to find you guys. Be patient with us.
I think that.
How do I
last
send
group-
it right here?
Yeah, hit that.
Okay.
And then go my name.
My name.
Mm-hmm.
Jazz.
I just saw right there.
Right. Perfect.
Okay.
But that's sending her a message. Is that an invite?
No, that wasn't a message.
That was an invite?
Yeah, she should.
So hopefully this works out. Be patient, guys. We're just trying to get my name Jazz on here from the Johns Hopkins Hospital. Again, she has been bedridden for 3 weeks, and she won't be able to see her baby. Her and her partner won't be able to see her baby. So we're just trying to get to her right now.
I'm gonna text her.
Okay, hold on. Let me see. Can we get it, guys? Can we get this? Okay. Oh, it says she's unable to join. Okay. I don't know why. All right. Well, I am going to try. The next person is Pretty Smile. Let me see here. Pretty Smile. Pretty Smile. Oh, she's on. Okay, she said she's on. Okay, how do we do this? Okay, how? Okay, request. It's doing the same thing it did last time. My name Jazz says she's on. What does that mean? Move to general? What is it? I'm just going to do like this for now.
Yeah.
I'm just going to do like that for now. Okay, she said she's on. Okay, so my name Jazz is on. Why can't I get her?
You should be able to just hit request with live.
Right, but where's the request with live button? Why haven't I figured this out by now? Okay,
See, what you were in before was right.
right here, right?
Yep. No. Hit that.
Right here?
Yeah.
Oh, yay.
No, not what you just hit.
Guys, I swear.
Sorry.
Hold on. I'd like to say hi to Tanisha.
Hello, how are you?
She's helping me out, guys. Hold on, I swear, this is so frustrating.
I don't know if I'm really helping. But
Okay, hold on.
Can I click something?
That's the questions.
That what you're clicking right there should be.
This should be coming alive,
Yes.
but it's not. I'm just wondering if I need to reset my
Maybe it's there's too many people on.
No, it should not be the case.
I don't know.
Okay.
Hang on.
View. Okay, we're gonna try again. My name Jazz. Hold
See,
on.
but it's not even. Oh, right here.
There it is. Off the camera. Hold on.
Sorry.
I was waiting for her. I think it's gonna work.
Hi!
Yay!
Finally.
Praise the Lord. It's like I'm losing. I felt so bad last week trying to do an Instagram live with someone, and it just kept saying unable to join. I'm just like, I really want to have this conversation with you. So I'm glad this works. So your Instagram name is My Name Jazz, but what should I call you?
Jasmine.
Jasmine. Awesome. Where are you at right now?
So I'm currently admitted to Johns Hopkins Hospital, and I'm admitted because I went into labor. Well, my water broke 2 months early. So I'm admitted for preterm labor, which means that that's why I couldn't leave the hospital. So he's going to be born anytime from now until the next 2 weeks. And so as far as the NICU, because they have to take him out early because of risk of infection, he'll have to go to the NICU. So with everything going on is, visitation on whether or not me and my husband can go to the NICU. It's all up in the air. And if I have to have an emergency C-section, then he's not allowed to go in at all if I have to have a C-section.
Oh man.
So, I was like you at first, where I was worried about, oh my goodness, we both are first time parents, and so we couldn't have baby showers because our family's out of town. And now I'm like, oh my goodness, now he may not even be able to see his son being born and all of that. So
that makes me want to cry. I'm so sorry that's happening to you. I'm actually crying. I'm so sorry that's happening to you because, it is a blessing when you get to experience your birth with your little one for the first time. But I do want to encourage you to tell you, I think the most important thing is that your baby is healthy and to the best of its ability, because you're going to deliver earlier.
Right.
So it's so I think that's kind of where we have to be as moms. It's like where we put ourselves first, because not ourselves, but put our babies first, because we're thinking more about what's best for them during this time. And that's a huge sacrifice that you guys are going to make, for your baby. But I mean, I can only imagine for you the first time you heard it,
It's been crazy, because even with everything going on, I'm like, okay, I'm not due until June. So maybe by June, things will die down, because I've been hearing about possibilities of spouses not being able to be there. And then boom, my water breaks early. So it's, we've been having a long road. I originally almost went into labor when I was about 4 months pregnant and had to have an emergency surgery. And so then it was life or death for, our little one. So I'm grateful to be further along. So it's more of a NICU stay now. And, the baby shower stuff is kind of put on the back burner. It's not important for us, but, it is stressful for both of us to be first time parents. And as of now, he pretty much lives in the hospital with me, because the visitation policy has been so up in the air, and we don't want to risk him going
out and then coming in.
And then they change it. So he's been, luckily able to work from the hospital and live here with us and have his snacks and everything. So
praise the Lord. What's his name?
His name is Chris.
Chris, we got to send Chris some love for being a trooper with you.
And we even were able to do, my mother is a photographer, Katrina Cross. And so we did a virtual FaceTime, like maternity shoot, because I didn't get to have any of those pictures where she was able to guide him, like stand on this angle or stand on that angle to take photos. So we're able to get a few photos of me being pregnant at least. So that's good.
Oh my goodness. That is amazing. That's like how we were doing the other day, where we had to, literally everything that we're having to do now is virtual. Obviously, everything we have to do is virtual during this time. But doing my ultrasound the other day with Russ on FaceTime, as I was saying earlier, it was just really kind of like, it was surreal. It was different. The facility that we were in, that I was in, was the traffic was incredibly light,
Right.
lighter than the norm, significantly lighter. But, I think the biggest thing is that we're all taking the precautions necessary, to protect us in this time and to protect our babies, our unborn babies. And then I have two of my kids have asthma. So I also have to think about them in the process too. So I just really want to be extra careful because they're also highly susceptible to the virus too. But it's, I don't know if there's any question that you can think of that you'd want to ask when my doctor, Robert Katz, is going to get on at some point in time. If there's any other question you would have, I do know he told me when I kind of explained your situation that every hospital kind of has its own set of rules. And I noticed, I think in what you submitted to us is that you're saying it's day by day as far as like what the rules are going to be. So I'm the question that you would have for my doctor as well.
I guess one of the questions is, so right now they just changed as of like maybe 2 days ago that all moms that go into active labor will have to get tested for COVID. And it's been a lot of debate on, since my husband is living here with me at the hospital, if I get tested for COVID and test positive, that he has to leave the hospital and I don't have contact with baby for a few weeks. And I guess I would like to know what's his thoughts on the husband having to leave, because I would assume if he's been here with me this entire time, it's kind of like, well, is it beneficial for him to leave if I get tested since he's here with me already? Or kind of what's that thought process is on the husband having to leave if I test positive?
Okay, awesome. So when he hops on, I'd love to hear what his thoughts are in response to your question. And, Jasmine, I just want to say to you, being a mom and knowing all that we're built for everything that we go through. So I just want to encourage you to stay encouraged. And you seem like you're upbeat in your process, which is
trying to be so much going on, trying to be positive.
You have to. I think that's the most important thing for us to withstand this time, is to stay positive and to stay hopeful and to stay prayerful and to keep our faith strong and to do what's best for our babies. Honestly, I think that's the most important thing, and especially for someone like yourself who you're also your situation is even more compromised because your water broke early. And so, you're just trying to do your best to make sure you're staying as healthy as you can. And, your body can hold on for as long as it can. So one of my doctors we always say, are part of our team, we say, let that baby cook, so I let the baby cook in the belly for as long as it can. So I'm glad for you that you made it to this point. And we're going to be praying for you and thinking of you. And I think the biggest thing for me is to let everyone know, especially the pregnant moms, especially us, is that you're not alone in this time. Like we really are. We're alone together, as they say, during this time. And I'm glad that I was able to share a conversation with you. And I hope that any other mom out here watching can be encouraged by your story. But again, God is a miraculous God. It's just amazing to see like how we come through every challenge that we face, whether it's expecting a baby, whether it's life challenges that are thrown our way. The way God has made us as women is incredibly special. And so I have no doubt we're going to believe that your baby's going to cook in that belly for as long as it can.
2 more weeks, please, at least.
2 more weeks. Let's go. 2 more weeks. And then also we're going to send some love to Chris for being a trooper with you. We're going to declare that you guys are COVID free, that you don't have COVID. Okay, that's not even happening. Right?
Yes, we have our mask right here when anybody comes in.
Exactly. Put the mask on. And so we'll be thinking of you. And I look forward to seeing what my doctor says about spouses having to leave, if you get tested positive for COVID, what that, his thoughts on what that is. So look out for his answer, and then we'll be thinking of you. And I'm just praying for you to have a successful delivery and a healthy baby. That's all we should want, right? For us moms, I'm like, a healthy baby, right? Hang on in there. 2 more weeks. You got
Thank you.
this.
2 more weeks. Thank you
Let's
so
go.
much for
Everybody
having
send some
me.
love to Jasmine right now. 2 more weeks. Let's
2 more
go.
weeks. Thank you so much.
You're welcome. Thank you so much.
Bye.
Okay, bye. Ugh, man, my little nose is watery. Guys, I tell you, when you're pregnant, you cry so much, your hormones. But it's crazy. Okay, so I think we have our next person that I'm going to try to reach out to. It says Pretty Smile 345. I'm going to try her. She is a pregnant nurse right now. Here we go. Let's see here. I don't know. It's something that happens here. Sorry, guys.
I wonder if I need to delete and re-download Instagram.
Probably so.
You
But I can go here. Because we ended up getting her last time.
Yeah.
Hold on, guys. I said my broadcast is blurry. Hold on. If I pick up the phone and do this, maybe that will help me. Oh, they're saying wipe the camera. They're saying it's blurry. Is this better, guys? Hold on. They're saying it's blurry.
It might be the Wi-Fi.
I may have to hang up and call right back.
Is it still blurry?
Yeah, I don't know. It said it's still blurry. Okay, I think I may hang up and call right back, guys. Okay. So, no, they said it's not blurry.
Okay.
Hold on, we're going to get there. Okay, my next person is going to be Pretty Smile. 345. All right. Is it our Wi-Fi? Maybe I do. Uh-oh. Okay, let's see. They said we can see you and hear you perfect, though. It's okay. Okay, maybe I hang up and try again, guys. But the Wi-Fi is full. It's still blurry. Okay. Gosh, I don't want to hang up. I hate when I have to do that. Let's see if it gets better here.
Yeah.
Everyone's saying restart, but I don't want to restart. I hate when I have to do that. Okay. Whew. Sorry. Okay, how is this, guys? Is this better? Tell me if I'm still blurry. Is it still blurry? It's still blurry. Don't hang up. Okay. Maybe so.
What's it saying?
I'm going to hang up and I think I'm going to hang up and call right in. Okay, guys, because everybody's saying it's really blurry. So I'm going to hang up and call right back. Everybody jump back on because Dr. Katz is going to hop on with us so we can have a good conversation to hear more about the things that we all wonder about in this time of COVID-19. So I'm going to literally hang up and call right back, okay? Okay. Call back in. Okay. Sorry, you all. I'm just trying to get it together. All right, so the next person that I'm going to talk with is Pretty Smile 345. I'm sorry. I'm off of the camera. Hold on. They're saying it's much better. Okay, I think Dr. Katz is hopping back on here. Okay, everyone said it's fine. It was good enough. Okay, but it's okay. But everyone's saying it's better now, so I think it was worth the hop off. Now I'm going to look up Pretty Smile.
Oh, no.
Yeah, Pretty Smile 345. Okay, that's not showing. Come on. I wonder if we ever get in touch with her. Pretty Smile.
Go back.
Oh, here, you can search it. Okay, guys, we're just trying to get on one more person here, and then if I can get like 1 or 2 more people, I can then hop on with my doctor. so we can hear from him. All right, and I can also pull up some of the questions that are in the box. Those are always fun. Okay, so exit out of there. You can try this here. In the interim, while we try to find our other person, I'm going to check the question box here and see what people have to say. It says here, need more questions in the inbox. Okay. All right. Well, maybe what I can do here is I think I'm gonna hop on with Dr. Katz. Can I see my notebook, T? I'm gonna hop on with Dr. Katz because I know that I have some questions for him and he'll be able to help us. Hold on here. But these questions are for all of us. Sorry, guys. Hold on. Sorry, guys. I'm struggling right now. The struggle is real. Man, my eye.
Pretty smile 345 confirmed.
Oh, she smiled. Okay, but she she confirmed. Hold on, guys. Why is it not letting me tell her to request?
Okay.
It's not even letting me click on this thing. Oh my gosh, I do this every time. What is up with my lives? What is really going on? Like, why can I not properly do my live chats with people? Tell me, why am I losing so much? Hold on. I'm pressing the number. Okay, let's see. Hold on. Pretty. Smile. Okay, there we are. Send. Okay, and then maybe I have Dr. Katz. I'm losing. Just want my Instagram live to work. Let my Instagram live work. Please. Okay, let's see. All right, let's see if I can find. He said just sent a request. Okay, I'm going to try Dr. Katz. Okay, here we go. It's not even allowing me to press it, though. It's weird. There has to be something wrong. Maybe if I try from my other phone. Okay, guys, hold on.
See his request.
He said he sent a request, but I can't.
Bobcats.
Okay. I sent that back. And then what happens here?
Cruising.
Keep doing that. I'm pressing view. It's not letting me do it.
Can you try to request?
I wonder if I try to do live. How do I do the request?
Or try to search.
Because I ended up being lucky with... I'm going to try this phone, guys. Hey, guys. Hold on. I don't even know what to do, guys.
Yeah, this is interesting.
All right, I think I have to hang up and try once more.
Wait.
No?
No.
What happened? Okay, don't give up.
Nope.
Let's turn this back around.
What is going on?
It's so weird. Maybe if I try my other phone, it will work.
Do you want to try that?
Let me try. I think I might try one more device here, guys, to see if I have luck. Otherwise, I think I have to have a chat with Instagram because...
Tell him to comment.
Yeah, okay, Dr. Katz, put a comment on there.
At least
Oh, okay, I see. Tell him to comment.
Yeah.
That's how we do it.
No, that's how we did it last time.
Okay,
Yeah, this is good.
comment, Dr. Katz, and then I can punch you in there. I think it's going to work, guys. Same thing for Pretty Smile 345. This is going to work, guys. Hold on.
Looking for podcasts.
There we go. Perfect. Go live. All right, just waiting for Dr. Katz to hop on in here. Oh my gosh, praise the Lord.
Wow. That is harder than delivering a baby. That's all I can say.
I concur. But we made it. Praise the Lord. I'm so happy.
Good job.
Yay. Everyone, Dr. Katz is in the building.
I have to thank my IT people, though, because my girls helped me out with this.
I know. Come on, girls, hop on here so everybody can see your faces.
Hi.
Awesome girls. Just awesome girls who are actually at home with you now because of COVID. They typically would live in New York, but they're here in California with you, right?
I must say, I feel it's a mixed blessing because it's sad that we have to live under these circumstances, and it breeds a lot of anxiety, but there's a silver lining to everything, and the silver lining is that we get to be home with our family and enjoy our family and be together, and you can't take that away. And it's all about being safe and being together, and we're lucky.
Amen. I think that's kind of been our perspective here is, I think for me, my greater concern I always have is just for the general population, because I know that these times have created another layer of challenges for people that already had challenges at the base of their worlds and what they're doing, and their jobs and all that stuff. But I will say, I think it's a blessing to be able to spend this much time with our families and to kind of try to do our best to find the positives during this time, which I know you and I talk about this all the time, especially for the expectant mothers. What are some of the things that we need to know? What is the way that we can kind of face this thing head on, and find the positives in the experience? Like we have my ultrasound yesterday with you and Russ having to be in the car and do the FaceTime.
He looked good in the car, though. He looked great in the car.
Darling, he looks great everywhere, if I must say. No, but it was different. It was different to have to do our ultrasound that way. And I just remember, by the way, guys, I actually wore my mask upside down in the office, but Dr. Katz was looking at me, and then he was like talking, and I'm like, why is he turning his head? And he's like, you have your mask upside down. And we're basically talking to each other through the mask. And I refused to take my mask off and turn it around. I was like, you know what? I'm stuck like this because again, living in the COVID space, I had on gloves. I went in with gloves. I didn't want to touch the elevator button. And then thank God for you guys being so sweet to me that I changed my gloves like multiple times when I was in the office, and you guys would give me a new set of gloves, but I'm just trying to take every precaution to protect myself, to protect my future baby, and then also my babies at home. So I think that being said, I have a list of things.
We're trying to do the same thing for you. And as upsetting as it is that Russ couldn't physically be there, we're trying to protect you from all the other fathers that want to be in the office as well. And I think that if we limit the number of people, and the whole reason why California and what we're doing so well is because we're adhering to these rules of wear your mask, wash your hands, do the social distancing, and all that stuff. If you really do it, the odds are it's going to work and help. And I think that our biggest concern is safety to the healthcare workers, safety to our moms, safety to the babies, and safety to the fathers as well, and family around. So I think that's the most important thing that we take from this.
Yeah. So that being said, I don't know if you got to hear the young lady I was speaking with earlier, and she was talking about her situation where her water broke early. She's now in hospital. She's on bed rest, hoping to make it 2 more weeks with her baby still staying in her belly before having to deliver, or whatever may, whenever that time may come for her. And to your point about the husbands and stuff, what is your thoughts on her scenario? Because in my mind, I don't know about everybody else, but when they say that if she tested for positive, then her partner would have to leave the hospital, wouldn't it make sense for her partner maybe they, I don't know, maybe they separate, but doesn't he get tested too? And then I don't know. I'm just trying to wrap my head around like what is the best thing to do, or why would the partner be removed from that hospital, from her hospital setting, if that makes any sense.
So a couple things. First of all, Jazz is very lucky that she's been able to keep the pregnancy going for, this extra time since she broke her bag of water. So I think that's fantastic, number one. And number two is, this is a time right now with that there's so much change, and the epidemiologists of the hospital are really trying to figure out what is the safest thing for the patient, the husband, and the baby at this time. And as you mentioned, last week there was one rule, next week it's another rule, and these rules are changing, daily. We at Cedars, we were testing all the moms for COVID for a week, and we found out nobody tested positive, so they've now stopped doing the testing. And husbands are allowed in the labor room, and partners are allowed in the labor room, and partners are there for the delivery in C-sections as well. But that's at one hospital. Everybody's got their own, there are hot spots around the country, such as in Brooklyn and New York City and some other hot spots where the rules are different, really just to provide safety for everybody. So nobody's trying to punish the husbands or the moms or anybody. We're really just trying to be safe for them, and we're trying to devise what the right answer is as you go along.
Yeah, so hopefully that helped you out, Jasmine, because I know you raised a question about that. And I was just saying to her, I gave love to Chris as well, her partner, for being a trooper with her, because he's basically living at the hospital with her right now, so he doesn't leave and come back in.
You know what the good news is? She'll have the baby for the rest of her life too. So that's fantastic.
Amen. Exactly. So they'll play catch up on their experiences together with the newborn baby. So then also, okay, so then there's a couple of questions that I have for you. I wanted to start with the testing part of it, just to kind of re-educate ourselves. I know we all hear about like the type of testing that's available during this time for pregnant women. But also in general, I know when I was talking to you, there were kind of a few new discoveries, like the possibility of testing blood by blood work and stuff like that. So can you kind of update us on what your understanding of that piece of it all is?
So let's start just from the beginning. The deal is that if you have a fever, if you have a productive cough, if you're short of breath, those are all potential signs of the COVID virus, okay? And really, if you have mild symptoms, the best thing you can do is stay home, drink fluids, rest, take it easy, okay? So that's the most important thing you can do. But if you are symptomatic, then they do have testing that can be done either within the hospital, or they have tents outside the hospital. And again, every hospital and area have different rules. And what has been done up until now is the nasopharyngeal swab, where they take a little Q-tip and they try to get a specimen and they send it off. The good thing, if the test comes back positive, it's most likely that you have it. But if it's negative, there's still up to a 30% chance of there being a false negative, meaning the test is negative, but you really have it. So it's not a great test. So right now, the hospitals are trying to study the different types of blood tests, like an antibody screen, where you take a sample of blood and you can actually test to see if the antibody is present. The problem is that right now, and you got to be very careful, because there are some private companies that are trying to do these things and they may not be FDA approved. So you really want to use something that is FDA approved and something that has been studied. And so we're now, Cedars just opened up a blood testing for the employees to find out if anybody was positive, to see if it's real. And if not, and then hopefully be able to roll it out so we can do more testing for everybody.
Yeah, that'd be huge.
It's still a work in progress, and we just have to be patient. And the other thing we have to be patient for is a vaccine also, because that will certainly help us out in the future. But testing is definitely an issue, and they're working very hard to find out what the best test is so that we can help our patients.
Yeah, I think that would be huge, because I know there was also the question about the amount of kits and things like that we had for testing, and how it kind of limited the opportunity for as many people as possible to get tested. So I look forward to hearing more updates on that. And I do think the opportunity to do testing by blood work will be huge.
The antibody screen will definitely definitely be more sensitive than the nasopharyngeal swab, we're hoping, but we'll
Yeah.
see.
Awesome. Okay. And then so the next question I had, that my first instinct when we start hearing a little bit about the pregnant woman, because like I said, they don't talk about us pregnant women as much as I'd like to hear as a pregnant woman in the media. But I said maybe there's a positive too, because it doesn't seem to be like a lot of women that are expecting are getting the virus, which seems like a lot of people are being as precautious as possible. And I'm pretty sure I can speak on behalf of most pregnant women around the world that we take extra steps to like really keep ourselves like, clean as possible, and like just taking all the precautionary measures that we need to take to stay as safe as we can. But my first instinct, I was like, well, we should deliver the baby at home. That was like what I was thinking. I was like, home is going to probably be better than being at the hospital. But what are your thoughts on that as far as home deliveries versus the hospital deliveries during this time?
That is a very, very great question, and a lot of people are asking that question as well. It turns out that the hospital is a much safer place to be. Number one is when you walk through the door, everybody gets their temperature checked, everybody's wearing a mask, and all the nurses are very, very careful at making sure that your experience is safe and healthy. When you do something at home, you don't really know who's coming into your house, where they've been elsewhere, if they've been tested, who else they've been in contact with. And the hospital is taking extreme precaution right now. And you really don't want to change course because of this fear. And I still think it's a lot safer. And you never know what happens at home too, because if there's an emergency, then you have to get quickly sent to a hospital for whatever complications that may arise. So you are much safer and much better place to be in a hospital at this time, especially than at home. I feel very strongly about that also, by the way.
Yeah, I know you told me, you was like, as your friend, I strongly advise against that. And if you say something like that, then I know it's factual. Because I know you will always want to do what's best for the baby and for the mommy as well, and of course dad.
Right.
So then, all right. So what happens? I think you talked about this, like what happens if we kind of did, but what happens if I get symptoms? Which I kind of feel like we touched on it a little bit.
We did, yeah. Again, a very good question, and the most important thing to do is what you would do even if you were not pregnant. You'd stay at home, you'd drink fluids, you'd rest, you'd take care of yourself, and make sure somebody puts food underneath your door so that you don't come in contact with them. But we're still doing a lot of testing and studying, but so far, as of now, nobody's shown that there's any vertical transmission. So even if you were COVID positive, there's not a lot of things showing that the baby would necessarily be affected. The biggest risk factor would be, if you really got sick, would be more like preterm labor and preterm delivery, more so than a complication to the baby as a result of the COVID, but it would potentially make you deliver early.
Right. Yeah. So, I mean, I feel like I'm looking over my list of all my things that we talked about. We talked about who's allowed in the delivery room, which we talked about that, and how it's every hospital's different. At Cedars, you guys are actually allowing the spouses at this moment, but you talked about like the process of that all.
But they're also allowed in the C-section room too, if somebody needs a C-section. So they get to be with that entire experience. So we're just not having outside family members present. But again, thank God we live in today's time where you can FaceTime and Zoom and do all those things.
Yeah, I know. It definitely was surreal doing that the other day, it was just kind of like, what? It's just a reminder of the times that we're in, where it's almost like we're living in a movie. And it's kind of, okay, what is this? Where does this go? How is this going to continue to develop? And, I know we talked about before how it was at one point in time that in New York, for a short week, they were not allowing spouses to be into the deliveries, but now that seemed to have changed. But
yeah, they realized that was not a good idea.
Yeah, and I think, and then also too, for example, the girl Jasmine and John Hopkins, her hospital's different too, because they don't allow the spouse to be in the room if there's a C-section.
That may change though. You don't know what's going to happen next week, so
she did say things are going day by day.
Yeah, exactly.
Yeah.
So hopefully that's
Yeah, I'm trying to see some comments here. Let me see. Thank you for taking time out to talk about this. If there's any other questions anyone else has, it'd be cool for you guys to put some on the board now while Dr. Katz is here, because we
you
could,
know, just in continuing the conversation, you know, it's very anxiety producing and everybody's nervous. But again, if you do all the right things by, you know, we're here. I'm even going to demonstrate.
oh, let me see
Keep
here.
your mask on, everybody.
Mask, keep your mask on.
Keep your mask on.
That's exactly it. I definitely am practicing that. I don't leave the house really for anything. I haven't had to leave the house for anything really, and unless it's the ultrasound and stuff like that, like the big necessities and important things in my world and in my life. And that's kind of been our attitude here. And staying home has been huge. I know the curve has been flattening. It seems like it's actually working with us being home.
Hopefully by July, when you're due, things will be a lot different. Hopefully we'll have some kind of normalcy.
Yeah, I think that I think I agree with you that things are going to continue to get better. I believe it is, as long as we all stay home. I think that's the key, is everybody staying home and giving as much opportunity for guys like yourself to do the research on how the virus can be attacked from the clinical perspective. And then again, us doing our part. So I'm grateful that you hopped on this call with me. I hope that everyone on this call that needed some questions answered got some of those questions answered. Because again, I don't think that you hear too much about us pregnant women during this time. And
let me add one other thing, because you had that nurse that was curious about something. And I take care of a lot of physicians as well as nurses that are pregnant at this time. And I think the most important thing is that their hospitals or their situations just take them out of COVID related areas. You can still, you know, do your whatever you do, you know, you can still do your nursing, or you can still be a physician and be in a hospital setting. But just I'm sure, you know, you tell your administrators and they will put you in the right place. I think that's the most important thing for that.
Sweet. Dr. Katz, you are the
best. Thank you so much for having me on.
I know, this is a treat.
Pleasure. Once again, I want to thank my IT staff and your IT staff.
I know. Listen, we couldn't do without them. Your daughters are amazing. You're an awesome doctor, but you're also an awesome dad. And again, I hope that today was a little bit of insight for those that needed it, for all the expectant mothers and even just the families that are surrounding that and supporting that expectant mother, from the husbands to, you know, the sisters, the grandmas, everyone. And hopefully maybe we won't have another round of this conversation, but any that we do, I look forward to us talking again and you giving us all updates. This is healthy.
Congratulations to all your pregnant patients, all your pregnant followers, and just go with the flow. That's all I have to say. Go with the flow.
Go with the flow. And you're in the middle of a delivery basically right now.
I did one right before I got on with you, not in the middle. I finished that one.
Because I know sometimes you can take a break and then go back, but that's amazing. So you're outstanding. Thank you so much for your time today.
All right. All the best to you and the family. Okay.
Awesome. Bye, guys.
Bye-bye.
Okay.
Say bye.
Bye, ladies.